Crohn's disease is an inflammatory bowel disease characterized by transmural inflammation that can affect any part of the GI tract. It occurs in a bimodal distribution and results from the complex interaction of genetics, environmental factors, gut microflora, and intestinal immune function. Crohn's is classified as either stricturing, penetrating, or non-stricturing, non-penetrating. Presentation may be an obstructing process resulting from fibrosis with subsequent stricture formation, a penetrating process with development of an abscess, fistula, or free perforation, or as an acute inflammatory process with pain, sepsis, or bleeding. Patients can have anal manifestations of disease, including fissures, ulcerations, strictures, abscesses, and fistulas. Gross histologic features include creeping fat and a thickened mesentery, skip areas of involvement, linear aphthous ulcers in the mucosa, and cobblestoning. Microscopic features include focal infiltration of neutrophils or lymphoid aggregates and non-caseating granulomas or aggregates of macrophage derivatives known as Langerhans giant cells. Surgery for Crohn's disease is not curative and reserved for complications of disease, so it is necessary to minimize the extent of small bowel resection. Obstruction is the most common indication for surgery in patients with Crohn's disease and can be secondary to acute inflammation or result in fibrosis and strictures. For small bowel strictures, interventions include endoscopic dilation, stricturoplasty such as the Heineke-Mikulicz or the longer Finney stricturoplasties, or a segmental resection with a stoma or primary anastomosis. For colonic strictures, if associated with an anastomosis, endoscopic dilation can be first attempted. Otherwise, surgical resection is used because there is a higher risk of underlying malignancy in colonic strictures. Symptoms of Crohn's colitis can include cramping abdominal pain associated with bloody diarrhea, tenesmus, and in severe cases, fever and peritonitis. Crohn's colitis can involve the entire colon and rectum, and at times be impossible to be certain if the diagnosis is Crohn's or ulcerative colitis. These patients may carry a diagnosis of indeterminate colitis. If an urgent or emergent resection of fulminant colitis is required, a total abdominal colectomy with creation of an endoileostomy is the procedure of choice.